So when I was going to school, I was fascinated by techniques that were a bit more specific. I really liked Gonstead because of the x-ray analysis and the instrumentation, the skin-on-skin palpation and adjusting. And, you know, upper cervical in the beginning sounded more like a dogmatic fairy tale. You know, why would you adjust 2 bones when you can adjust all 24 vertebrae, right, in the sacrum? But then I saw examples of full back thermal scans that the thoracics or the lumbar spine, where there was inflammation before, it had gone away through upper cervical care. And so now my main clinical indicator for why to adjust was being corrected through this one precise technique. And that, combined with the consistent miracle stories of chiropractic, almost always involving upper cervical, really drew me into upper cervical. So if you look at the history of upper cervical, Bill Blair graduated at a time that B.J. Palmer had evolved upper cervical and chiropractic to the point of taking x-rays, doing thermal imaging, and adjust people lying on their side with the drop headpiece mechanism. And so that's what the Blair technique does. Now, it involves a lot of torque, and once again you'll see videos of BJ adjusting on the rooftops where he too did a lot of torque. Well, so did Bill Blair. Why? Because Bill Blair graduated and learned from BJ in a time that there was a lot of torque involved. Now, there's a reason why we utilize torque, which we go over in our seminars, but my point is the Blair technique is a natural progression and evolution of what B.J. Palmer was doing and learning and evolving. It's a side posture drop adjustment in a neutral position with a very dynamic, what we call a toggle torque adjustment.
Hi guys, my name is Justin. Here today at Sherman College, we're doing an intermediate Blair seminar with Dr. Ian Bulow. And I just want to begin talking about Dr. Bulow. I love the way that guy teaches. He's very meticulous, and he's able to break it down in a way that everybody can understand the concepts and be able to make sure that before we move on to the next concept, everybody's able to understand it and apply it and really just understand the Blair work.
There are really 3 things that make a chiropractic technique unique or different from any other chiropractic technique. Number 1 is the analysis. How do you know when to adjust someone versus when not to adjust someone? Or if you adjust them, how do you know if the adjustment was a good adjustment or a sham or a bad adjustment? So in Blair, we utilize, what I like about Blair is we utilize all 3 of the major upper cervical analysis protocols. We do thermography, we do a leg check protocol, and of course we do palpatory findings. So knowing when and when not to adjust, in my opinion, is actually one of the very most important aspects of any chiropractic technique. And the second thing that separates different techniques from one another is the x-ray analysis or lack thereof. Whether or not you take imaging or not is a big deal in the Blair world. I always challenge students that if you are going to say as a chiropractor that this segment has moved to the right or to the left, I'm going to challenge you to prove it. The body is not formed symmetrically, so anytime we look and we feel or we draw a line in the spine and assume that it should be plane or level to the ground, we are basing that on the assumption of symmetrical or symmetry. And so in Blair, we don't do that. We look at the actual articulations and when they come together, and with the advent of cone beam 3D CT scanning, we're able to really analyze the articulations on a world-class level. But through the brilliance of Dr. B.J. Palmer and Dr. Bill Blair, we also teach some advanced x-ray techniques that allow us to see where the joints come together specifically, so that we're not at the risk of the possible errors that can be found in more traditional analysis systems that are based on symmetry. The third difference in any technique is the actual technique itself, how we were actually adjusting somebody. And Bill Blair graduated at a time that B.J. Palmer was doing side postured upper cervical with the drop mechanism. Now, I personally really like that for a couple reasons. Number 1, patients in neutral. So that is a benefit in and of itself for a myriad of reasons. Number two, the drop mechanism itself is congruent to our chiropractic philosophy. Your job as a chiropractor is not to move the bone. Your job is to help the innate intelligence of that patient move the bone. If the body is so intelligent, we shouldn't have to force things. We should be working with the body to achieve higher levels of stability. So that drop mechanism, or that break in the table, allows for almost like a fuse, like a tripwire, where we can provide a highly dynamic force, but the table is going to absorb a lot of that. But in the process, that atlas is going to resonate with that force and is going to move in the process. So to me, it's a really beautiful culmination of a lot of different forms of analysis in one adjustment. It really, to me, kind of emulates Dr. Palmer's quote when he said, when love and skill work together, expect a masterpiece, right? And to me, that's the Blair adjustment.
So I really like it. And Dr. Ian's a great teacher. He goes above and beyond. He teaches more than like the Blair work. He shows us marketing tips and management and like a lot of things, not just related to Blair, just about how to be a better chiropractor and how to serve your patients the best way you can.
Okay, with the Blair adjustment, it's a very dynamic adjustment that involves a lot of moving pieces. And after teaching it for 10 years plus, I can look at someone and very quickly be able to make tweaks and changes so that they're able to execute an adjustment that is quick, that is tight, that their vectors of force are not splaying all over the place, and that it's dialed into one focal point. And that's really what makes the Blair technique not only very difficult, but very awesome. It's a really great technique because it dials down multiple vectors of force into one contact point in 50 milliseconds of time. So anyone interested in learning about Blair and how to execute the Blair adjustment and getting certified in Blair and learning the work can do so first and foremost by going to blairtechnique.com/events. The Blair Society has an annual conference every year in October, and then there are regional seminars that are taught by individual certified practitioners like myself. So I would encourage you that if you're interested, please visit blairtechnique.com/events and see what seminars that I'm teaching are coming up. If I'm not teaching one and you'd like for me to teach, contact me. I'd be happy to see if we can get a group of doctors and students in your neck of the woods to be able to bring this work to you.